Hi everybody, Dr. Stu here, giving you science-based practical tips for COVID-19. I want to talk to you about home treatment today. I got a question that's been on my mind for a while, so let's read it. So this question comes from Brian in Ohio. Dear Dr. Stu, I am definitely in a high-risk group for COVID-19. 65-year-old cancer survivor, diabetic, overweight, and I have a rare neuroimmune disease. My wife and I are doing everything possible to avoid picking this disease up. But if I should become infected and have difficulty breathing, could I treat myself with my home CPAP machine to help force air into my lungs? Thanks, Dr. Stu. Wow, Brian. Brian, my heart goes out to you, and please, please continue to do everything you can to stay safe at home. So yes, you are in fact in the very high risk group based on your age and also your underlying conditions. But what I want to say, your question brings up a good point, is how much can you do at home? For those people that start getting really short of breath, where their oxygen level is dropping, that is actually the sign of some significant pneumonia going on in your lungs. So most people, if they have some lung involvement with COVID-19, they'll get a pretty bad cough, right? They'll get a fever, they'll get a cough. But if you start getting really short of breath and you're really having trouble breathing, that's really an emergency. And that's the time when you need to go to the hospital, because trying to manage your own pneumonia at home with a CPAP machine or home oxygen or any of those types of home remedies, it's not for somebody that's unstable, that is having increasing respiratory distress. The problem with COVID-19 is once you get to a certain tipping point, it becomes a very rapid deterioration. My friends working in the emergency department have often talked about or my friends in the hospitals actually, in the ICUs, have talked about patients that seem to be stable and then all of a sudden they get worse very suddenly. They sort of go over the cliff and down into being worse. So if you are getting sick and you're thinking that you're having significant respiratory distress, you need to go into the hospital. It's not okay to treat yourself at home. Very important concept. Thanks so much for sending that question in. If you have a question, please send it to us. Go to the website drstu, doctorstu.org, and send us your questions, and we'll answer them. Thanks so much. See you the next time.